Hello, my name is Jason Hawes and I am a physical therapist with WellSpan. Welcome to part 3 of WellSpan Spine Surgery videos. It's time to introduce the role of therapy and help further prepare you for your spine surgery. The main goals or objectives or the things that will be discussed in this video are getting to know the roles of your rehabilitation therapist, reviewing the spine precautions you may have after your surgery, and going over a few examples of doing daily activities while having spine precautions. A therapist can spend more time with you reviewing and practicing these activities. As you learned in the previous video of this series, you may meet some rehabilitation therapists after your surgery. Physical therapists, called PTs for short, help you learn the best ways to move your body after surgery. They want to make sure that you can get up and move safely with your spine precautions. They will also work with you on how to best move around your house. For example, they will make sure you can go up and down the stairs safely. Next are occupational therapists, or OTs for short. They will work with you to see if you need any type of special tools called adaptive equipment that can help you with your daily activities to make things easier while you are recovering. Some of the equipment that may be helpful are a reacher, a sock aid, a long-handled shoehorn, a long-handled sponge, a raised toilet seat, a tub bench, or a shower chair. You can buy these online at a local durable medical equipment store or pharmacy. Something else a PT or an OT may do is show you how to use a back brace or a neck brace if your surgeon has ordered one for you to wear after surgery. Not all surgeons will require you to wear a brace after surgery. If you had neck surgery, you may also meet a speech therapist. Speech therapists are also sometimes called speech-language pathologists, or SLPs. They are available for patients who had neck surgery and may have trouble swallowing. They may work with you on what foods you should and should not eat after surgery and show you techniques of how to swallow. WellSpan uses the phrase no BLTs for the precautions you have after surgery. No BLT stands for no bending, no lifting anything more than 5 pounds, and no twisting your spine. You will have these precautions after your surgery until instructed by your healthcare provider at a follow-up visit. Let's take a closer look at the B in no BLTs. The B reminds you not to bend. More specifically, you should not bend at your waist following back surgery, or do not bend your neck following neck surgery. Instead of bending at your waist to bend over, squat or bend your knees to reach lower items. While bending at your knees is safer than bending from your waist, any type of bending over may be uncomfortable right after surgery. The next precaution in no BLTs is the L for no lifting. More specifically, you should not lift anything that weighs more than 5 pounds. Things that weigh around 5 pounds are a half gallon of milk or a 2-liter bottle of soda. If you are carrying light items, especially if they are closer to 5 pounds, hold them close to your body to decrease the strain on your spine. The next precaution in no BLTs is T for no twisting. This precaution can be hard because we are used to twisting our spine and neck without thinking about it. However, do not twist at your waist or neck after surgery. Instead, get into the habit of keeping your shoulders and hips in line after your surgery when you are doing your daily activities. Turn your entire body instead of twisting your spine. For example, if I need to get something from one place to the next, I am turning my whole body, rather than twisting my spine. In order to help you follow the BLTs, we recommend that you get your house ready before your surgery. Think of things that you use every day, like your toothbrush or dishes. Do not put these everyday items in places that are too high or too low so you do not have to bend or reach every time you need them. Specific areas of your home that we recommend setting up before your surgery are your bathroom, your kitchen, your laundry room, and your dresser. Let's take a closer look at these spine precautions in action. Notice how he does not reach above his head when reaching into the cupboard to grab the glass. To turn away from the counter, he moves his feet instead of twisting his spine. Also, while carrying the glass, he keeps it close to his body to decrease the strain on his spine. Last, to avoid bending his spine, he bends at his knees as he places the glass on the table. Let's look at another example. Notice as he reaches into the fridge, he bends his knees and keeps his back straight. Now let's talk about safe sleeping positions for you after surgery. It is okay to sleep on your side or back after surgery, however, do not sleep on your stomach. You can use pillows to make your side or back sleeping position more comfortable. For example, put a pillow under your knees while you are lying on your back. This will take pressure off of your back. If you lay on your side, put a pillow between your knees or thighs. You can also keep a pillow under your upper arm when laying on your side. Let's talk about how you can get in and out of bed while keeping your spine precautions after surgery. Your therapist will teach you the log rolling technique. This is a way for you to turn safely in bed without twisting or bending. We will teach you this technique while you are in the hospital and give you a chance to practice. It may be helpful for you to practice this log rolling technique prior to your surgery so that it is easier for you when you have spine precautions after your surgery. If you are a back sleeper, the first move in the log rolling technique is to roll to your side. To get to your side, lift the knee on the opposite side of the direction you want to go. Push through that leg and reach across your body and roll to your side. You will roll your whole body as one unit, like the rolling of a log. To get out of bed, keep your back straight and use your arms to push your upper body into a sitting position as you lower your legs to the floor. Let's talk about your daily activities, or ADLs. These are things you do every day, such as dressing, bathing, and getting on and off the toilet. Occupational therapists will work with you if you have any trouble with your ADLs. Because you can't bend at your waist, it may be difficult to put on shoes, socks, or pants. There are adaptive tools that can make life easier. Some examples of these can be a reacher, a sock aid, or a long-handled shoehorn. An OT can train you on how to use this equipment. After spine surgery, it may be hard to get up and down from the toilet without bending your spine. The standard height of a toilet is about 15 to 16 inches off the ground. This is why a bedside commode or a raised toilet seat may be recommended. Adaptive equipment like a bedside commode or raised toilet seat can be used to make the height of your toilet seat taller so you can get on and off of it much easier. Some of these have handles, which will make it easier as well. Again, you can buy this equipment prior to your surgery, or you can also wait until you meet with your occupational therapist to make any decisions about buying adaptive equipment. In addition to making sure you are comfortable with moving around your home and using adaptive equipment, your occupational therapist will work with you on getting in and out of a car. Something that may help before getting into a car is to have someone slide the seat of the car all the way back. This will give your legs more room to get into the car. It may also help to have the seat reclined a little bit so that you are not sitting straight up. To get in, back up to the door. Hold on to something stable like the frame of the car. Do not hold on to the open door of the car, as this may move. Sit down slowly, turn your whole body forward, bringing your legs and shoulders into the car. Make sure to keep your hips and shoulders together so they turn at the same time and you are not twisting. You will use the same process in reverse to get out of the car. To get out of the car, start by turning your whole body toward the door. Hold on to something stable like the dashboard or push on your thighs to push yourself to a standing position. Again, avoid pulling on the door as this may move. Your rehabilitation therapist will work with you to make a plan with recommendations that work best for you, your home, and your daily activities. If you are having issues or concerns with any of the items shown in this video, please reach out to your surgeon to discuss if a referral to one of our rehabilitation therapists is needed to help in your recovery. Before signing off, I want to leave you an important reminder of when to call your surgeon's office. If you have any of the symptoms that are showing on the screen after your surgery, you need to call your surgeon's office or seek emergency care right away. Thank you for choosing WellSpan. Our rehabilitation therapists look forward to working with you. Good luck with your surgery.